Since our last podcast, the number of cases in West Texas has more than doubled to 124 cases. There's no reason to suspect that we're not going to see many, many more. And then just this morning, we're taping this on Wednesday, the Department of Public Health in Texas revealed that a child from Lubbock, Texas, who is not immunized and had been hospitalized has now died from measles. This is the first death from this outbreak. I've avoided talking about a topic on consecutive weeks, but for me, this is really important. And if we keep talking about it, hopefully our listeners will learn a bit more. And
so Howie, I just want to ask you one quick question. How does someone die of measles? Because you're basically talking about a healthy kid who gets measles. What happens?
There's three big categories, I think. The biggest one is measles pneumonia, where it's basically they're predisposed to getting a bacterial pneumonia after measles. The second one is a measles encephalitis, which is pretty rare. And the other really rare one is a measles colitis. So I think that the common thread is that measles reduces your immune response to many things and makes you somewhat immunocompromised and puts you at risk of other diseases that you then die of proximate to the measles infection.
And I think the reason I just was saying it, and sorry to interrupt, but I just wanted to make the point that I think sometimes people are hearing this and they're thinking like, yeah, so it gets inconvenient. And I'd like my child to get natural immunity, so they're sick for a couple of days and it's not a big deal. But the thing is, it can be a big deal. And for many people,
1 in 300 to 1 in 500, maybe 1 in 1,000, depending on the person, dies of measles one way or the other. And this is not dying with measles. This is dying.
This is not just being sick for a couple of days. This is actually a big deal.
Right. No, it's a very big deal. And I want people to understand also that we're not just watching this burn out in Texas. We're doing a lot down there. The public health professionals in Texas are testing, they're screening, they're isolating and quarantining, they're vaccinating, because even if you've been exposed, vaccination can occasionally help if it's early enough. They're communicating to the public and public health professionals, and they're trying to reduce this outbreak. But nonetheless, we're going to see many more cases and perhaps more deaths.